Sorry for wearing these glasses that are super reflective, but allergy season is upon us and my eyes are bright red. With that, let's get into it. A little bit about me. I grew up in Los Angeles, California. I'm a general and bariatric surgeon living in Pennsylvania. Went to medical school in Nashville, Vanderbilt. I did residency at Georgetown, and now I'm in a place called Scranton, Pennsylvania, Wilkes-Barre, Pennsylvania. You may know it from The Office. I grew up an obese teenager, so I know what it's like to be on the heavier side. My pants said husky on the label when I was young. And I personally believe that obesity is the most important modern day health issue that we're dealing with in this country and probably pretty soon worldwide. With that, let me jump into some of the side effects and how to deal with them. So, as you all probably know, GLP-1s act by slowing down your gut. They also increase the amount of insulin in your blood, so that's why they were used initially for diabetes when they first came out. But after many years of use, we realized that they also promote weight loss. But they do that, like I said, by slowing down the gut. So, the principal side effect is constipation, because again, the same effect that makes you feel full and keeps you what we use the word satiety also causes constipation. So how do we deal with this? The number one thing that you can do is exercise, go for a walk, be active. Any type of physical activity stimulates your gut, increases motility. Our patients after surgery, the first thing that we want them to do is get up and walk around because it starts getting their bowels to be active. The other thing that you can do is instead of eating 3 square meals a day like you used to before starting GLP-1s, you can start breaking down your meals into smaller portions throughout the day. This will help allow your gut to essentially move forward by processing smaller loads rather than 3 large loads throughout the day. Then next, you can stay well hydrated. So you want to drink a ton of water throughout the day. We recommend 64 ounces in a 24 hours, which seems like a lot, but if you keep track of it, it's accomplishable. That is probably important even if you're not on the GLP-1s. I would recommend taking 64 ounces of water every day, but definitely if you're using the medications here. Then the next thing is you want to avoid fructose corn sugar or corn syrup, sugars, complex carbohydrates, and processed foods. Basically, these things, what ends up happening is you eat these foods, they get compacted down into very much smaller volumes, and they basically just sit in your gut. And it's really hard for your gut to push these things forward, essentially. So again, these types of foods and sugars and carbohydrates cause constipation. And lastly, what you want to do is you want to really be on a high fiber diet or take fiber supplements. You probably have seen commercials for Metamucil on TV, but I take a spoonful every day, keeps you regular. Again, this is one of those things that even if you weren't on a GLP-1, I would probably recommend just for good gut health and to stay regular. You really want to be getting about 35 grams of fiber every day. So that covers constipation. Next, similarly, nausea. So why do we get nausea from GLP-1s? Again, the same issue. Basically, the drugs work by slowing down your gut. And so what that means is that foods and fluids in your stomach also stick around longer, and it takes a little bit longer for them to start moving forward. So treatment here is very similar to constipation. But one thing that I can say to add is that what we've noticed is that ginger and peppermint flavored foods and drinks really help with nausea. So that's like things like Red Bull, peppermint tea, ginger flavored water. So even 7 Up can help. This really does seem to help. The other thing that is not listed here that I frequently prescribe for patients in the hospital is for them to chew gum. Chewing gum, again, especially if it's peppermint flavored, can really help ease nausea. It also can stimulate your GI system to start getting to move on. So again, this can help with nausea. Again, similarly to constipation, you want to go and be active. So any type of physical activity, going for a walk, a run, any type of movement really stimulates your GI tract to start being active. And again, similarly, you want to eat small, frequent meals throughout the day. If these things don't work, you can ask your primary care provider for a medication called Zofran. It usually is a 4 milligram pill that you can take 3 to 4 times a day. And this is what we use from a medical standpoint to treat nausea and vomiting in the hospital. Even after any surgery, these are the medications that we prescribe to deal with the nausea and vomiting for surgery. And you can get these from your primary care provider. And the side effect profile for these drugs is very small. So your PCP should be able to prescribe them to you without any issues. Okay, so this next one is a little concerning for a lot of people because the thought of losing hair is obviously especially very concerning. But this occurs because by taking GLP-1 medications, you're eating less calories and you may not be getting enough protein throughout your diet. And when you lose protein, that's when hair loss occurs. So one of the first things that you really want to focus on is getting enough protein in your diet. And you can do this by making sure that you're eating the protein on your plate before the other things on your plate. So that even if you do get full with meals, you've gotten enough protein and basically skimmed out on the carbohydrates and the fats on your plate. The other things that you can do is to supplement your diet, because I know this from people who've taken GLP-1s in the past, is that they tell me that like I just can't eat enough or I just can't get enough calories down. I mean, I can't get enough protein because I'm too full to continue eating. If this happens, what you really want to do is focus on getting protein shakes. Again, smaller volumes, easier to get into your digestive tract and getting it to move along. And even if shakes are seem too thick, then you can get protein flavored or protein water now. Um, and so this is a little bit easier to take and will ensure that you're getting enough protein throughout the day. Thankfully, this is reversible. The other thing that you can do is you can take some supplements. So things like biotin, selenium, these types of supplements that you can get and that are often found in multivitamins are useful for ensuring that hair loss can be retarded. All right. Another one that has been commonly asked about is fatigue. So fatigue happens mostly because, again, your body is not used to seeing so many less calories than you were taking beforehand. So how do we combat this? The first thing that you can do is to stay well hydrated. Again, hydration is key no matter at any whatever you're doing. Mostly because it can keep you energized, it can keep you feeling awake. And the first thing that happens when you're dehydrated is you become tired. So staying hydrated is really important. Next, this is counterintuitive, but you actually want to stay away from caffeine and sugars. The reason for this is that they give you an initial bump, but they end up dehydrating you in the long run. And they also can give you a sugar slump after that little initial bump that you get. And it's also unnecessary calories that you really don't need. So I would actually say stay away from caffeine and high sugar foods and drinks. Again, similarly, exercise and physical activity can help you wake up. Again, these things stimulate your mental capacity. So exercise and physical activity are really useful for staying energetic throughout the day. The other thing that you want to do is ensure that you're getting enough iron and B12, which is something that's commonly X'd out when you start taking GLP-1s because people start eating less protein, especially red beefy meats. And so you can be iron and B12 deficient. To combat this, you want to be taking a multivitamin supplement on a daily basis. And actually, the one that I take every day, strangely enough, is just a prenatal vitamin. It's got all the multivitamins and supplement that you need for daily living. And the last thing that you want to do is you want to be social because one of the things that happens is that when you start taking GLP-1 medications, that you don't really want to be around other people. You may feel a little bit of a psychological shame from taking the medications, which you definitely shouldn't, but it's very natural for many people to feel that way. And you don't want to be around other temptations for food, answering questions about why you're not eating. But getting out there and being with other people and socializing is really useful for staying energized and feeling motivated about things. You'll also find that it's really important for something else that we'll be talking about here in a second. Diarrhea. So strangely enough, why does diarrhea happen? You just told me that these medications cause constipation. So why would it also cause diarrhea? Part of the reason why people get diarrhea from GLP-1 medications is that the timing of your GI system gets thrown off when you're taking GLP-1s. The timing effect or the slowing down of your gut is deregulated depending on what portion of your intestines and stomach and colon that we're talking about. So these medications will slow down like your stomach a little bit. They'll slow down your small intestine a little bit more, and they may slow down your colon just a little bit. And this throwing off of timing can cause things to move around in your digestive system at different rates and end up causing diarrhea. So how do we combat this? The first and most important thing is to stay hydrated. When you have diarrhea, one of the things that happens is that without you even noticing, you become dehydrated. And you don't notice this because you're more focused on the diarrhea. You're not paying attention to other aspects of your body that usually would be a warning sign that you're being dehydrated. So if you're having diarrhea, first thing to do is drink plenty of water. Again, 64 ounces a day. You want to avoid sugar and alcohol. These things cause diarrhea, right? So if you've ever drank too many beers or too much hard alcohol one night, you'll notice that the next day you may have diarrhea first thing in the morning. This is the reason why. So you want to avoid alcohol and high sugar foods. The next thing is that you want to eat small, frequent meals. Again, common theme throughout all these complications that we've been talking about. These things are not helping. You can turn to Imodium and Pepto-Bismol, which are medications that can help with diarrhea. And these things you don't need a prescription for. You can just go pick them up at your local CVS in the aisles. All right, heartburn. Heartburn is again, related to the slowing of the gut. Food doesn't empty out of your stomach fast enough, and so you can end up having acid and even a little bit of undigested foods refluxing back up into your throat. So how do we combat this? This is a common issue that I deal with, and actually, and even in non-GLP-1 patients who come in with heartburn, I treat frequently. And the recommendations I have for them before talking about surgery is you want to avoid eating 3 hours within bedtime. This ensures that whatever in your stomach has moved on into the small intestine, and there's actually a valve between your stomach and your small intestine, so that once the food and the fluids are into your intestine, they can't back up back into your stomach and then cause heartburn. So again, eat dinner within more than 3 hours out from the time you go to bed. You also want to stay away from acidic foods that consist of things like anything with a red sauce, spicy foods, citrus fruits, alcohol, and caffeine. You want to eat small, frequent meals throughout the day, again, rather than 3 large meals that we're used to. And if these modifications are helping, you can take medications such as proton pump inhibitors. This is omeprazole or pantoprazole, famotidine, which is Pepcid, and then Tums. These are all medications that you can get usually in the aisle at CVS, but sometimes you may need a prescription for. And you can also check to see with your PCP to find out if you have a hiatal hernia. Usually patients who have reflux and bad heartburn, they have an underlying condition called a hiatal hernia, which is basically a loosening of the um, ring between your stomach and your esophagus. And this is very common. 50% of people over the age of 55 have one. So heartburn becomes very common as you get older. And if your reflux symptoms were bad to begin with, they're probably going to get worse with GLP-1s. And if this is the case, you may want to get checked out to see if you have a hiatal hernia, because there is a surgery to fix this. Yeah, so that's heartburn. All right, so food noise. This is an interesting one, but why does this occur? Basically, you're not eating as much as you used to, and you can only become fixated on wanting to eat. And so you're constantly thinking about foods, things that you used to eat, and usually it's snacks that most people talk about. So how do we combat this? A lot of it is psychological. And because you're fixated on this, right? Basically, your mind is overcome with the thoughts of the things that you used to eat. And you're also used to the routine of eating. And now you're in a different routine. And you're trying to combat with the kind of rhythms that you used to be into. So we do that mostly by basically keeping ourselves occupied psychologically. So not being bored, right? So not sitting around watching TV. You want to go do something. Something especially if you want to be focused on like a goal or an activity that has a end process. So you want to engage in an activity that requires your mental intention. So something like board games, card games, anything competitive is very useful to get the food noise away. You can meet with friends in a non-sedentary setting. So going for a walk in a park, window shopping, anything where you're not just sitting around chit-chatting around food, basically where you're able to kind of like zone off and think about food. You want to be doing something where you're actually doing something physically, very useful. And then exercise, exercise, exercise. Can't stress enough. If you're doing something that's active, especially if it's something like a game, right? Like playing tennis, pickleball, even rock climbing, name whatever sport or activity you want. Something that requires you to think about winning something or achieving a goal or reaching a time. Those are all things that require your mental attention and can take your focus off food. And so these are the things that I would suggest for food noise. That in a nutshell kind of covers in a brief overview a lot of the side effects that we see with these medications, and I'm happy to answer some questions.
This one comes from Kendall. I keep reading to eat less often with more time in between meals to minimize the insulin spikes. What do you think about that?
I disagree with that. There's not really any data to show that. Really, you want to eat more frequent meals throughout the day so that and smaller so that the insulin spikes don't happen essentially, right? You get insulin spikes from eating big meals less frequently. You want to keep the same level throughout the day essentially.
Okay. What are some foods that are good options for fiber?
So fiber, anything with any beans, legumes, right? Peas, things that are have a complex shell. that don't broccoli has is high in fiber, spinach. Basically things that are harder, basically anything that is harder to digest usually has fiber, high amounts of fiber.
Regarding a multivitamin, I currently take D3K2, 10,000 IUs of D3, 200 of K2. If I add a multivitamin, will that be too much vitamin D?
No, you really just can't get enough vitamin D. You're just gonna be wasting it. Most vitamins, it's really hard to poison yourself on extra supplements and minerals. Like you have to be taking gargantuan amounts. So it's fine. I don't think you need the extra vitamin. You can probably just get away with just a multivitamin a day and just be fine. With our bariatric patients, we actually do blood work every, what was it, 2 weeks, 6 weeks, 3 months, 6 months, and at a year. So we take a full panel of all the vitamins and minerals in their blood just to make sure that things like vitamin A, D, E, K, iron, B12 are in adequate amounts. But everyone is on a multivitamin. And if you're on a multivitamin, you shouldn't have any of these issues.
Great. And this one resonated with a few different people. The day after my shot is the worst day for me. I'm exhausted and nauseous. Is that common? It totally zaps me for the whole day.
Yeah, very common. The key thing that I would tell you is to drink tons of water, and then also take, if you can, find some protein water. You can find it on Amazon. Drink protein water throughout the day, and you'll feel much better, especially if you don't really eat that first day after you take the injection, and you just hydrate off of protein water and water. You'll feel much better throughout the day.
That's good to know. I got one. Chevy hates drinking water. Is there something else she can drink instead?
You can take a Crystal Light is fine. Anything that has flavor, that's fine, but you just don't want to add excess non-essential high sugar calories to your diet in drinking whatever you're drinking. Like I drink, again, I don't recommend this. It's just what I love. I love drinking zero sugar Sunkist orange soda. I don't think it's the best thing, but it counts as like liquids. But again, staying hydrated with Crystal Light, I think, is a good option for most people. Yeah. Also, the carbonated beverages, I don't really recommend if you're taking a GLP-1, mostly because it may increase the amount of heartburn that you have. Because anything that builds up gas in your stomach will increase the volume in your stomach and cause things to kind of bubble back up.
Here's one. Do you think semaglutide has more side effects than tirzepatide, or is there any data around that?
No, not really side effects. I think the number one thing that people have found is that tirzepatide does increase the amount of weight loss in comparison to semaglutide. And so for the most part, I would say probably in order to get the results that you want at the rate that you want, you can take a smaller or lesser dose, I think. Again, this data isn't available yet, but that would be my suspicion. And that for that reason, because you take less of it to get the same effects, there may be less of a side effect profile. But again, that's just supposition at this point. It's not proven anywhere.
Vana joined a little late. Would you mind just rehashing if there was any supplements you recommended for constipation, or just a quick recap on constipation solves? It was fiber.
Hydrate, take smaller meals more frequently throughout the day. You want to avoid sugary drinks. Those are the big things. Basically, eat smaller meals, stay hydrated, 64 ounces of water. Make sure that your diet is mostly protein. Eating lots of fiber. Metamucil, a spoonful of that is basically 35 grams. And yeah, avoid processed foods. And then exercise. I can't stress enough how much exercise is useful, especially because exercise in itself, whether it's high intensity or endurance, increases the amount of GLP-1 in your system naturally. So exercising by itself will increase the amount of GLP-1s that's in your body, and therefore you may see better results and require a smaller dose. So exercise, exercise, exercise.
Here's a good one from Vanessa. Why do some people have no side effects?
That's basically essentially, so part of it is the diet that you're used to, right? Secondly, it's essentially what diet are you taking? Like, I know everyone in this room or everyone in this chat has, as you're taking these drugs, have different routines, right? Some of us are still probably eating piss poor diets, if I had to be honest. Some of us are eating, like, sticking to the regimen exactly as our primary care provider or as listed in like what we experts describe. Or some of us are exercising every day. Some of us aren't exercising at all. And so because of that, you're going to see a plethora of different side effect profiles. And if you just have to be honest with yourself, are you doing everything possible to essentially avoid the side effects? And if you're not, then you're going to have side effects. And again, I don't want to say that it's your fault, But I know from experience that most people don't follow the regimen that we provide, right? And so we try to do the best job of remedying the specific lifestyle that you're in, essentially.
Here's one. In your experience with bariatric patients, some bariatric patients find it hard to drink a lot of fluids. Is there anything you recommend for them when it comes to hydration and hydrating easier?
Yeah, the number one thing is it's really hard when you're feeling nauseous, when you're constipated, when you're feeling backed up in general, to drink large volumes of fluid in one sitting, right? Like when I drink throughout the day. It essentially comes in kind of like these sporadic bursts, right? Like because I'm operating, so I'll be in surgery for a couple hours, come out and busy, blah blah blah, and then I'll have to douse or drink like 16 ounces in one sitting, right? But really, for bariatric surgery patients and for most people who are on GLP-1s, what you want to be doing is drinking frequently, taking sips throughout the day, right? So for our bariatric patients after surgery, what we recommend is drinking an ounce every 15 minutes. And essentially, we give them a little sheet that they actually have to mark out how many ounces they drank in an hour. And they keep a time log. And so, in order to combat like feeling like you're gulping down fluids when you're feeling backed up, nauseous, whatnot, you want to take sips very frequently. Again, the more you break these things out, the better it is.
Here's a question about heartburn. Kendall was experiencing heartburn on 5 milligrams of tirzepatide, but notice when she moved up to 7.5, was having less heartburn. That seemed odd to her. Does that make sense? How does that track? And what do you recommend for heartburn?
No, it doesn't really track. I don't know why. I'd have to dig deeper into kind of getting a history from this person, but it doesn't really track. If you go up in dose, the heartburn should get worse. It may be that you made some dietary changes, exercise changes, or have some other kind of things going on in your body that, or other medical conditions, but it doesn't really track.
And then, do you recommend incorporating weight training in exercise routines? Sonia's heard that
Always.
that helps with weight loss.
I don't know about weight loss. The key to weight loss is this. I can't stress this enough. Your body is a machine. What diet you're eating, what intermittent fasting, all these things, I'm not gonna talk negatively against them. I'm not gonna be supportive of them. All that, and at the end of the day, all that matters, you can think of your body as a machine. It's calories in, calories out. Burning more calories throughout the day than you consume, you're gonna lose weight. Now, the only thing that you have to remember for GLP-1s, or if you're losing weight on your own off of these medications, is you want to ensure that you're getting enough protein. So those are the only things in my mind that matter. If you want to weight train to build up muscle mass and stay bulky and, be a little bit more toned, that's great. If you want to do complete aerobic exercises, endurance, look like a marathoner, that's fine too. But at the end of the day, all that matters is calories in, calories out leads to weight loss. All the other stuff, extraneous, it's all kind of basically people promoting their own kind of pie portion of the pie. But all that matters is calories in, calories out.
Here's one from Misty. Is it common to be extremely cold while on the medication? She finds herself
Yeah.
freezing all the time, wears her coat inside.
Yes, very common. And it's basically because your metabolism is going to slow down, right, when you're on these medications, because your body is going to transition down. And I don't know at what time it'll ramp back up or when it'll transition back, but it is frequently common for people to start feeling a little bit cold throughout the day.
Okay. Oh, here's one. What are your thoughts on? I've heard you talk about this before. Maybe you can lightly touch on it for the group about taking GLP-1s forever. Is that necessary?
No, I stress so the drug companies want you to tell you that you have to be on the medications forever. But the truth is that if you use these drugs as a kind of a jump start or like a spark plug and get yourself into a routine where you're eating, get into a good dietary habit and exercise routine. I just told you that exercise itself creates GLP-1s naturally in your system. So if you can get yourself to a point where, feeling more comfortable going to the gym, you have experience now doing the exercises, like whether it's weightlifting or it's going for a run, joining a running club. But basically, you get into a routine to do all these things. You can come off the medications and you'll find that you have the same satiety that you did when you're on the medications. This is how people who are already very fit stay fit, is that it's easy for them to stay fit because their body is in a natural groove in terms of how much GLP-1 it's producing, how much exercise they're having, the psychological benefits, the endorphins that are coming from exercise. They're already in that like sweet spot. So that's why they don't need, GLP-1 medication. So you too can get there if you can use the medications to help you get to the same place and then essentially ride the routines that you develop in that manner. Unfortunately, that'll have to be the last question for today, but thank you for joining in.